Hello. I am I hope everybody had a great holiday. So I'm just gonna talk about the topics for chapter 1 and chapter 2 that was due on our past lecture. Chapter 1 being the nursing profession and chapter 2 being health and wellness. Okay. So chapter one, basically we're discussing what the meaning of nursing is. And I guess you could probably pretty much say where did nursing originate. And as we always all know, nursing is an art and a science. Um, And the whole purpose of people being a nurse is to deliver care artfully with compassion, caring, and respect for each patient's dignity and personhood. Um, so, as a science, nurse practice is basically based on a body of knowledge that you learn, and that knowledge base is continually changing, and it changes based on how time changes, as technology changes, as all those type of things change. So nurses, what do nurses do? um they respond to the needs of patients. They actively participate in policy. um they respond and adapt to challenges, and expand knowledge through research. So nurses do research. Um, if any of you decide to go on further in school, you'll see that you will have research. And the whole purpose of research is just to find a better way to provide care. Find out if what you're doing through studies is what is appropriate, and it determines the best practices. So nursing within itself is what one would call a dynamic field. And when you discuss dynamics, you want to say that um, that dynamic field is evolving. That's what it means. It's changing throughout time. So that is what, when you look at the history of nursing and what that type of thing is. Um, when we look at the history of nursing, you can't ignore uh, the beginning of the profession. Nurses have studied and tested new and better ways to help uh, people and to reduce uh, illnesses. And one of the main um, people that you hear people discuss is a nurse by the name of Florence Nightingale. Florence Nightingale, she first practiced what they call epidemiologist. She's the first practicing epidemiologist. And an epidemiologist is someone who basically um, studies disease and how that type of thing grows. She also organized the first school of nursing. She improved what they consider sanitation in battlefield hospitals. And her initial practices, even though they were like in the 1850s during the Crimean War, are still like noted practices that nurses do even today. So you have the Civil War to the beginning of the 20th century. Uh, when you talk about the Civil War through the beginning of the 20th century, you're gonna think about and you're gonna know some of the nurses that are connected with nursing, that are people who've had the title in one way or another as being a nurse. And you got the Civil War, you have people such as, we can start, with the first picture, a woman by the name of Clara Barton, who was a founder of the American Red Cross. Um, she basically cared for soldiers on the battlefields, and she cleansed their wounds, met their basic needs. Um, you also have Dorothea Lynn Dix and Mary Ann Ball, who they call Mary Ann Ball Mother Bickerdike, and Harriet Tubman. And that's the people that you see basically on the first row in that order that I mentioned them. And who all pretty much like influenced nursing, during um, the Civil War. Um, that Dorothea Dix, she was really good as far as she was what they considered a superintendent of the female nurses of the Union Army. And she was good at organizing hospitals, appointing nurses, and she also oversaw and regulated supplies to the troops. Mother Bickerdike, or who we call Mary Ann Ball, organized ambulance services and walked abandoned battlefields at night looking for wounded soldiers. Harriet Tubman was active in the Underground Railroad movement, and she assisted in leading over 300 slaves to freedom. And as a result, she had to be a big caretaker of them when they had wounds and different things like that imposed. The second line of pictures is, we're going to start with Mary Mahoney on the left in the second row. Mary Mahoney, um, she was what they was Mary Mahoney was basically the first professionally educated African American nurse. And she promoted relationships between different cultures and races, and she is probably one of the main ones who noted about, cultural diversity and respect for an individual, regardless of what their background, whatever color, race, or religion that person was. Isabel Hampton Robb helped found the Nurses Association um, in the United States and Canada back in 1896. And it later became what they called the ANA, which is the uh, the American Nurses Association. She authored many nursing textbooks, like about, doing principles and practices, and um, she was, really good at talking about nursing ethics, and she was also one of the founders of the American Journals of Nursing. So that would be Isabel Hampton Robb, the second person. And then the third and the fourth people on there is Lillian Wald and Mary Brewster. Um, they focused on health needs of poor people who lived in tenements in New York City. Um, so they was one of the ones that wanted to expand what they probably call community health nursing and that type of thing. So I would like get familiar with these names so that you can just kind of have an idea. I mean, you don't have to know, um, like the whole thing, but if you just kind of know for testing purposes, and I'll kind of make you aware of that as well about, these individuals and what role they played in nursing. That would be great. So, just as you know, they have, when you think about nursing and you think about influences and how nursing was established through the 20th century, which would basically be um, the 1900s, which is considered the 20th century. I just had a list of things that went um, on during the 1900s. And you have to always keep in mind that nursing was, I mean, mainly noted as a profession for women. I don't even really know if you would even, if they even considered it so much a profession like the way they do now. But there was always a movement towards scientific or research based practice. And it's always was defined by a body of knowledge. So, like in 1901, the Army Nurse Corps was established, and you could see that happening. There were, like especially in the late 1800s and mid 1800s, and you're talking about wars and various different things, and they had nurses out there actively with the troops taking care of them. And so they formed in 1901 the Army Nurse Corps. Those were established. Um, in 1906, Mary Adelaide Nutting, she was the first professor of nursing at Columbia University. In 1908, the Navy Nurses Corps was established. So the Army first, then the Navy. In 1920 to 1923 was when the study of nursing education emerged. And that is what my degree is, like my advanced degree is. I went the nursing education route. Because I just feel within nursing education, I can practice, but I always feel like, it's always so much more to learn, and it's always good to see nurses facilitate, learning as well. In the 1940s and 1950s, the associations formed, and when I talk about, oh, I'm sorry, I did skip over the 1920s. In the 1920s, that's when the specializations emerged. Like, oh, I'm a good nurse at delivering babies, so I'm gonna be a midwife. I'm a good nurse at taking care of kids. So I'm gonna be a pediatric nurse, you know, or I'm gonna be a trauma nurse, or whatever it is that you specialize in. That's when that emerged, and then uh, they started forming more associations and that type of thing in the 40s and the 50s, and then in the 1990 and For some of you guys, y'all probably might not have even been born, because I know my son, he's 31 and he was born in 1988. Um, they established the American Nurses Association Center for Ethics and Human Rights. And a lot of that kind of stuff was, um, I can say, started because of the fact that there were things that was going on as far as with like, I don't know how many people heard about the Tuskegee experiment and that type of thing. And I used to have a video, and I don't know, on a thumb drive of a movie about the Tuskegee Institute and that type of thing. And what I'm going to do is I'm going to play with it, and I'm going to see whether or not I can upload it to Brightspace, so that when y'all get a chance, on your free time, and it really, what it does is it really, really, really gets into ethical principles. And when we discuss ethics and stuff, I'm gonna have that on the week that we discuss ethics. I'm gonna have that video. I hope I'm able to download that video so that you guys can view it and see uh basically what happened with the Tuskegee um uh airmen, and what happened with the Tuskegee project, and how it impacted a particular nurse. And maybe we can have like a brief discussion after everybody, view the movie. And it's entertaining. So, I mean, you could even like watch this movie with it has some main actors in it, and you can even watch this movie like with your kids and everybody, you know. Maybe not too young, because a lot of people, kids probably don't have no idea what syphilis is, but like preteens and that kind of stuff, yeah, you can watch it and it's entertaining. Okay. So here we are now in the 21st century. And in the 21st century, what happens is basically um you have changes in, you know uh because we're growing, and there's so many different challenges, out there for nurses. Just like right now we have the COVID-19, and stuff. And so we have, as a result, there are things that we may have to add into the curriculum, find out about, and like bioterrorism. I remember when I was coming up, um, they used to have what was that called? Anthrax. That was the thing, where basically what you're saying is, and people were afraid of the mail, and if you get some powder in your mail, it could be anthrax and that type of thing. And then you have emerging infection, like right now, people, they don't really know, really truly, they have not really truly studied this COVID-19 or this coronavirus. And sometimes I may say COVID-19, or I may say coronavirus. You have to just excuse me, because I'm speaking, uh sometimes we call it COVID-19 because they say that that's when COVID-19, I'm sorry, because the coronavirus started in 2019, and they said that's why they called it COVID-19. So I may use those interchangeably. So just excuse me. Then disaster management. Who knows more about disaster management than us at uh, 911? I don't know how many of you guys was born when that happened. If you're 19, you was probably just a baby, you know. So um that type of thing. If somebody put a bomb, you still have to be a know who's gonna go in there and after the fact take care of these people. Who's gonna take care of these people that have these emerging infections and have this coronavirus? What type of things do we have to do to protect ourselves? You have technological advances. Nowadays, we have things that we can do on the computer. Everything is computerized, where really it's very helpful because of the fact that it limits the amount of mistakes people make, but at the same time, it's probably a little bit more efficient. And then, of course, end of life care. And end of life care can be something that's very, very, um, I could say touchy with some people. Some people like hospice. Um, it can be very, I could see a hospice nurse getting depressed when I was doing IB care and I was working for Washington University, I we had departments and I would go out and change the PCA pump that people had a home PCA pump with narcotics in it and I would go and change them and we had a specific lock and there would be another nurse there and she was an RN but she would do end of life and hospice care. They help people basically who knew that they was terminal, they would die at home. So that, I mean, on a day-to-day basis, I could see how that could be like very, very, very depressing for someone. Okay. So as a result for that, there's a big need for a strong and current knowledge. So what you have to keep this in mind. It's not going to be that you are going to be a nurse and you're going to stop learning. No, you're going to continuously learn. You're going to continuously uh, try to do things that you need to do. I mean, it's a continuum. So we need that's them strong people that can bring current knowledge and can execute that knowledge. And the reasons for that is because we have more age and population. People are living longer, and then we have a high acuity level of care. Acuity being people who are sicker, you know, that you have to care for. And then at the same time, they tend to want to discharge people. And that's a whole nother thing that has to do with, managed care and insurance companies and that type of thing. So we need nurses that are able to do the things out there to keep us going. So I do want to tell you guys that I'm going to go back on that slide just a little bit because I want to tell you guys that you need to remember these things that I'm saying. We have curriculum changes, we have a need for stronger current knowledge. You need to be able to recognize the reasons that I told you that's on the slide for these things. And related to what I'm saying, so, influences on nursing. So you have influencing on nursing, um, and there are healthcare reform and cost. Healthcare reform affects like not only home healthcare is paid for, but how it is delivered. I mean, so as a result, there's like a greater emphasis on health promotion illness, disease prevention, all of those types of things. It's more community based, and you have to keep in. That's why it's such a big, dialogue about that. one of y'all might want to get into or be, over like the ICN or work up in Tallahassee and be on various committees and stuff affecting change. It's like um the the law just got passed where the nurses can prescribe narcotics now in Florida. And that was a big thing because for a while they couldn't. And I mean, this happened within, I guess, maybe the last month or so, where nurse practitioners can prescribe narcotics. And I do know what the fight was on that because a lot of physicians started feeling like, they doing too much. They prescribing treatments, they doing this, they doing that. But some of them realize that with all the need out there, everybody will have enough work. And then you have demographic changes. Demographic changes is a big deal because the census is starting to go up. You have people, steady increase of people. You have people that uh, shifts. They one person to move to the rural area. People are more mobile, and you'll see more people of this ethnicity here and more people. So all of the different things that we do is influenced. There's medically underserved people, people who maybe because of their financial means or the fact that they may live on a reservation. All of these people are just like forgotten people that it all impacts nursing care. And we talked about the need for emergency preparedness. There's what they call workplaces issues. A lot of times you'll see people part of the American Nurses Association uh, uh, and workplace issues, things like ergonomic issues, like making sure that someone is like if you're at work, you should be able to sit somewhere where it don't make your back start hurting, or you should be able to know how to deal with certain things, and get certain rules and laws and stuff like that passed so that you can do your work more effectively. And then, of course, the nurses shortage. I remember it was at one point in time where they were saying that there was no nurse shortage, but I knew that was a bunch of bunk. There's plenty nurse shortages out here. So that's something that's real. We can there can never be enough nurses. Okay, I mean, and people to initiate what the physicians need done. Professionalism. Nursing is a profession. It is definitely a profession. And I remember, and I'm sure, like I said, you have to think about the times and the progression of nursing. And I remember there was a time when you wouldn't even see male nurses, you know. But now we're getting our masters, we're getting our doctorates, we're doing, things, and we treat nursing as a profession, something to be proud of. Um, what is the characteristics of a profession, and I want y'all to understand what the characteristics are. I remember when I got my nursing degree, at the time it wasn't like it is now where there's a computer and everybody can just the next day, we had to wait like 6 weeks in order to get our nursing, whether or not we took our NCLEX with at that particular time we called it our boards. We were just like, oh, we're going to take our nursing boards. And everybody took it at the same place, and it would usually be at whatever the capital was of that particular day, and it was given twice a year, in February and July, because it was like if you graduated in January or December, end of December, you was getting yours in February. And if you graduated in May, June, you would take it in July. So they only offered it. You would have to wait 6 months. If somebody did not pass their NCLEX, they would have to wait 6 months. And like I said, it was usually in an area like at mine was in Jefferson City because I was in Missouri. The nurses that lived here in Florida would have to drive up to some convention hall in Tallahassee. That's how it was done. And so in order for you to be considered a profession. And I remember when we would wait, and we waited 6 to 8 weeks to get our results. And most of us were working as what they call graduate nursing, and we was getting paid nursing salary, so that would have been just like a shame to get demoted, after you took a position and stuff. And I saw it happen to a few people and stuff. But anyway, that's why it's very important for you to try to know all the concepts behind it. But I do remember the day when I found out that I had passed, and it came in a letter, everything came in the mail, and it said, "Dear professional registered nurse." I still to this day have that letter, "Dear professional registered nurse." And I kept that letter, and so it is a profession, and it makes you feel good. It'll be a feeling that you probably never thought that you would experience. And so I want you guys to remember these, because you'll be tested on this stuff. And it's not so much memorizing as it is seeing it and knowing what it means and what these characteristics are. It requires an extended education, it requires a body of knowledge. So, an extended education, which means that you, in order to be considered professional, you're doing something extra. You're going to school extra, uh, to obtain a certain body of knowledge about a particular subject. And by doing this, you provide a specific type of service. And then it requires autonomy, which means that as a professional, you should be able to decision make, you know, and it incorporates a code of ethics. So those are the characteristics for you to be considered a professional, because as a registered nurse, that is what you are going to be. Okay, so also, uh for you to be a professionalism, it we was discussing that there's a particular educational, um in nursing, you have, in order for you to be considered a nurse, you have different levels. Um you are going to be either LPN or LVN or a registered nurse, one or the other. You can also get certifications in advanced nursing, and they also require you to do continual education and take in service hours to keep yourself up to date before you can even renew your license every couple years. So keep that in mind that it's a constant learning. It's not a, oh, I'm here and that's it. So professionalism, we we talked about theory. Uh, we theory is when you develop like a certain view about something where you describe or predict any type of activity that's going on. So they have what they call theoretical models, which provide frameworks for how a nurse should practice. Like, for instance, you have different theorists that you'll learn about. You got people like or Orem, who talks about the self care deficit, or you got Roy, who is a theorist, and she talks about the adaptation theory, and Benner's, uh, and it's like a whole bunch of them. Some of them they say are a little kooky and stuff, but that might be something that you might want to look into. And some of these nursing theorists are still living, and look at and find out some of the theorists and what are their ideology about, what like drives they practice, what drives them. You have people that talk about comfort and various things like that. So there are different theories that, and some of them they'll seem when you read up like they kind of kooky, but they are theorists and they were able to do studies, they were able to follow things, and they came up with that particular ideology. As far as autonomy and accountability, it's very important as a nurse that you are accountable, and it's very important that um, you do have some latitude in how you work as a nurse. Uh, and then you do have a code of ethics, which means that there's certain things that you are going to incorporate and certain practices where you will just know that uh, I, I can't do this because I'm not giving high quality care when I do this, that, or the other. And then as a result of that, you can get into serious trouble by that. So, when you say a nurse is defined as a profession because nurses, and then you see this quiz here, they perform specific skills, practice autonomy, utilize knowledge from the medical discipline, charge a fee for uh, services rendered. Uh, they practice autonomy. That was one of the things that I said that helps nursing um profession for nurses, what is helps define them. So all the things that I said, you have to really remember. Okay, standards of nursing practice. Uh, care, cure, and coordination. You do have to have a innate ability to care. You have to think about a cure or helping somebody get over an ailment, and you have to work together with other people to obtain it. So, care, cure, and coordination is some essential components when you're practicing nursing. So, nursing standards provide the guidelines for implementing and evaluating nursing care. So, we'll already tell you through the Nurse Practice Act. You can look up the Nurse Practice Act, and it'll tell you what type of things that you are not going to do, or you go by not only the Nurse Practice Act, but you follow policies and guidelines wherever you work. Because we have to find a way to ensure that you're going to give adequate or proper care. Okay? So here, we had Ming with an associate's degree. It was a case study. And although Ming enjoys his work, he got a 2-year degree. He's a nurse and he works in a long care facility. Um, and he was promoted to a supervisor on his unit. He only been a nurse for a year. He wants to pursue a nursing career that offers a regular schedule and more autonomy than he currently experiences at the long-term care facility. So Maine considers going back to school, okay, for an advanced degree. Nurse Practice Act. Each state has its own Nurse Practice Act. Nurse Practice Act, NPA. What did I just say? Each state has its own Nurse Practice Act. Most nurse practice acts are similar, but there may be some things that may be a little bit different because they have to pass, vote on it, and everything. Reflect the growing autonomy and expanded roles and scope of practice. And that's through licensure and certification. Okay, so responsibilities and roles of the nurses. Nurses are caregivers. They're advocates, which means you always work for your patient's best interest. You're an educator, which means you're constantly teaching uh, individuals what to do. You're a communicator, a provider of care, caregiver, and provider of care. And then you're a manager, which means that you watching how things are going. Like when I was telling a group of y'all about how you doing the care, how you doing a care plan. I told y'all then, a caregiver advocate, you're a provider for care, you're a communicator, you are managing that person's care by making sure that that individual is doing the things they're supposed to do, and you watching by tweaking to see if something's being done right or wrong. So you're providing care, you managing care, you're educating them, you working as an advocate because you're trying to do the best thing for them. So as a nurse, you're doing all of those things. So you have different roles, career development. And within career development, you have advanced practice registered nurses, you got clinical, and up under advanced practice registered nurses, you have what they call the clinical nurse specialist, you have nurse practitioner, certified nurse midwife, and certified registered nurse anesthetist. They are the ones that give the anesthesia. Clinical nurse specialist, nurse practitioner, certified nurse midwife, and certified registered nurse anesthetist. They are a nurse practitioner could be a nurse, like you get your nurse practitioner and become it in adult health, become it in pediatrics, become it in family, which means you can take care of everybody. You could be a nurse midwife and help deliver babies, help take care of pregnant women. Clinical nurse specialists or people who specialize in something, like you can be a diabetic nurse educator, you could be a wound care nurse or something like that. And then everybody pretty much knows what a registered nurse anesthetist. Then they have, you could be a nurse educator, as that's what I am. You could be a nurse administrator, that's what Dr. Wright is. and you could be a nurse researcher. I know a couple nurses that work in research. That's what they love to do. And they work in that role. So you can look at this and you can see all the different opportunities and all the different things that a nurse can give, you know, within that practice and provide, you know. So yeah. So just know what falls up under what. So basically, remember I was talking about Ming who had the 2-year degree and he wanted more autonomy and he wanted to become an advanced practice registered nurse. So if he wanted to be an advanced practice registered nurse, which one of these would he be? He could be a everything except for A. A physician's assistant do not fall into that. He can be a clinical nurse specialist, he can be a certified nurse midwife, and he could be a certified registered nurse anesthetist. The only thing that they didn't put on there was a nurse practitioner. Okay? So it would be B, C, and D. Okay. National League for Nursing or some organizations. And I just want y'all to be like aware of what they are. This is the National League of Nursing. Uh, advances excellence in nursing education to provide prepare nurses to meet the needs of diverse population and changing healthcare. So the National Nursing uh National League of Nursing is more like, you know, somebody that work, it's like a professional organization and it's somebody that work to advance, you know, the I guess you could say how people look at nursing, uh, notoriety of how nurses are educated, you know, like models of how nurses should be, that type of thing. The American Nurses Association, um, basically improves standards, and they're involved with standards. Of care and making sure that people are doing uh the correct thing. And keep this in mind, the American Nurses Association is a part of the International Council of Nursing. Okay. So both of them are like what they seek to do is seek a higher status for nursing, uh, political, professionally. They talk about financial issues affecting healthcare and nursing. So you'll find a lot of people really where they get involved with the politics behind it and the lobbying, and to improve standards. Like, you know, they're up there in Tallahassee marching, you know. And then you have the National Student Nurses Association. Every campus just about has a group, and if any of y'all are involved or like that type of thing, you can pretty much go and become a part of our National Student Nurses Association. They do a lot, you know. Oh, and it's the same as the Canadian Student Nurses Association, but um, they do a lot, and you could join our chapter, and it's like a lot of fun. And you know what? It kind of helps you to stay involved and stay up to date as far as what's going on campus, what's going and you see a lot because they do a lot of things in the community. And they make money and they do bake sales and they have fun, and you feel like you part of your campus and you part of you know, doing things. And then there are other professional organizations that focuses on other areas, like they have one for midwifery. They have one for us, for educators. They have, they even have like a Black Nurses Association, so, or Latina, or, you know what I'm saying? So they have groups that focus in on specific areas that you might decide that, you may be very much interested in. So when I say the NLN and the ANA are professional organizations that deal with nursing issues of concern, political and professional issues affecting healthcare, financial issues affecting healthcare. Basically, they're all of the above, which is D. Okay, so Ming decides to pursue his career as an advanced practice registered nurse. Which patient populations may he serve? He can do adult, he can do neonatology, he can do psychiatric as an APRN, advanced practice registered nurse, you know. So look at all of that. And prison inmates wasn't checked off, although, yeah, he could go work on it. But what they want you to do is be specific on the certain things that a person can. You can't get a advanced practice registered nurse degree in prison inmates. So that's the reason why that wouldn't be on there. And trends in nursing, last but not least, um we want to always focus in on patient-centered care, teamwork, and working with other people, to evidence-based practice, quality improvement, safety, and informatics. So those are the things that are under uh QSIN, which is quality and safety education for nurses. So if you ever hear anybody say anything about quality, safety, education for nurses, or you hear them say QSIN, that's what they're talking about. Those are the things that they find strategies and initiatives for is patience, teamwork, evidence-based, quality improvement, safety, and now they've added informatics on it because that's a very important thing now. Okay, so if Ming chooses a career as a critical care nurse, his specialty will be identified by which means. He's a critical nurse, certified nurse, certified nurse specialist. He's in critical care. What type, when you identify his specialty, what makes it what will be the identified by which means the fact that he's doing critical care? I'm gonna tell you, it's the setting, it's the setting, it's where he's doing it. He's practicing critical care, so he's going to be a ICU nurse. So you can have all types of populations in ICU. You can have all types of disease, all types of care, all types of problems. But the setting is what identifies his specialty, the fact that he works in the ICU. So, uh, there are more trends that are coming out in nursing. You have genomics, which is the study of inheritance, and it can influence treatment decisions because I do truly believe that people have certain things that work with them or whatever, and it's inherited, you know, where you're looking, everybody in the family got a certain disease process. uh, Public perception of nursing. We tend to have more media coverage. Um, our nurses' approach to care have to be good because of that. But I'm not too worried about the public's perception because anybody that I tell that I'm a nurse, they always say, "Oh, that's really good." I looked it up and they said that nursing um it was a poll or something taken, and I can't remember from where, but it was, like a real poll, like from a reputable poll that said that nursing is the most trusted and admired profession. So if you think about that, you think about the type of what you are really, really getting yourself into with nursing, okay? And be proud that you are a nurse. And I am so glad and honored to even see that there's more males into it now because now since there are more, they know now they can make more money being a nurse because there was a time when nurses didn't make no money. And we had degrees. They know now that nobody's looking at them like, oh, Mr. Punk, you are a nurse. Don't nobody care about nothing like that. I found that some of the nurses that I've met that were male nurses were some of the best nurses. So it's like everybody can have something to bring. So effective nursing on politics and health policy, like I was telling you about lobbying for healthcare improvements, maybe joining uh, 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 the National League of Nurses or American Nurses Association to improve standard. And then whatever personal involvement that you can do or anything that you think you can do, any little bit makes a difference. The fact that you're going to school to become a nurse, your job will be your contribution, to society. And that's something to feel very pleased and glad about. So, this is a nurse here giving a shot, saying you may feel a little pressure. Oh, this is a thermometer. So, look how big it is. That's very funny. So, if anybody has any questions, feel free. This was chapter 1, and I'll get with you on chapter 2. But pay attention, look at my notes on the slides as well as listening to me. Thank you. Take care.